Hello, my name is Roger Knaggs. This short CPD session will provide some insights on how pharmacists can support people to provide relief from acute pain with combination analgesics that are available over the counter from pharmacies. Combination analgesics are medicines for pain relief that combine two or more active ingredients, often paracetamol or ibuprofen, in combination with other medicines. These combinations are designed to provide improved pain relief compared with the single ingredient medicines. By the end of this session, you will be able to understand the complexity of pain management in community pharmacy settings, understand and communicate evidence-based information on the efficacy, safety, and use of combination analgesics as second-line treatment for pain, compare different combination analgesics based on their efficacy and safety profiles, and propose how pharmacists can appropriately recommend and support the use of combination analgesics in practice. Pain is extremely common and affects millions of people throughout the world. Indeed, many of us experience pain on an occasional or on a regular basis. However, it is a unique experience to the individual. If two people each place their hand in a bucket of ice cold water, the time taken before each person removes their hand will depending upon their perception of pain at the time. Every pain, whether it be after excessive activity in the garden or following trauma or surgery, is influenced by a range of biological, psychological, and social factors. Experiencing pain impacts all parts of an individual's life, including physical activity, their mood and emotions, their sleep, activities at home and at work or education, and relationships and social activities. In combination, these reduce quality of life and can lead to greater utilization of healthcare services that result in higher healthcare costs. Even though pain significantly affects all aspects of a person's life, many remain uncertain about how to manage their pain effectively. Pharmacists are well placed to provide education about underlying causes and management options, and to encourage the use of non-pharmacological treatment options, such as application of heat or cold, and also the supply of medicines, both those that are available over the counter from a pharmacy and those provided on prescription. Pain is complex. As most types of pain have multiple underlying pathophysiological mechanisms, the optimal strategy often requires a combination of drugs that have multiple mechanisms of actions that target different parts of the pain processing pathway. For everyday pain, single over-the-counter analgesics, when used alone, are only effective for a relatively small proportion of people. So it is rational to use several analgesics that have different mechanisms of action. Rational analgesic combinations can also have fewer side effects. Acute pain usually appears quickly, often in response to an injury, surgery, or trauma. It typically lasts from a few minutes to a few weeks, but sometimes can extend to a few months. Acute pain alerts the body to potential harm or damage, promoting protective actions such as rest and attracting the person's attention to require action or to seek help from a health professional. Once the underlying cause of the pain is addressed and the body heals, the pain usually subsides. Combination analgesics containing two or more different drugs that have different mechanisms of action. And those that are available depend upon where in the world you are. Most combinations either include paracetamol or a non-steroidal anti-inflammatory drug, commonly aspirin or ibuprofen. Many combinations may also include an opioid for mild to moderate pain, such as codeine or dihydrocodeine, although there is much debate around their effectiveness, and there are increasing concerns regarding dependence if used for prolonged periods. In some countries, codeine-containing analgesics are no longer available. Other constituents include caffeine, isometheptine, a sympathetomimetic amine that causes vasoconstriction and can benefit tension headache and migraine, or antiemetics such as buclazine used for acute migraine. Some ibuprofen and paracetamol combinations have been formulated to allow rapid dissolution. The rate of absorption of paracetamol in this formulation, measured as the time to peak plasma concentration, was 10 minutes faster than paracetamol alone, and the mean plasma concentrations for both paracetamol and ibuprofen were higher following administration of the combination tablet. This means that fewer doses may need to be required, resulting in lower exposure to both drugs. In a Cochrane review of 10 systematic reviews, including 21 different over-the-counter analgesic drugs, doses, and formulations, combinations of ibuprofen and paracetamol were most effective and had a success rate of over 70%, with a number needed to treat of 1.5 to provide one person with additional 50% pain relief. This was much higher than paracetamol and aspirin individually at various doses that had success rates between 11 and 43%, with a number needed to treat of 3 or above. There was no information on many of the commonly available low-dose codeine combinations. And regarding tolerability, the proportion of participants experiencing a side effect were generally not different from placebo, although the combination of ibuprofen and paracetamol, the rates of adverse events were lower than with placebo. The first approach in managing acute pain is to recommend that a medicine that contains a single analgesics, and combination analgesics should only be recommended when pain has not been relieved by one of the individual constituents. They should not be used for long periods. And if a person considers that they need to take combination analgesics for long periods, the cause of the pain may require further assessment by a healthcare professional. When choosing a combination analgesic for an individual, it is important to consider other conditions that the person has, such as it would be inappropriate to consider ibuprofen for a person who has had a recent gastrointestinal bleed. It is also important to review other medicines that the person is taking or is prescribed to ensure that there are no drug-drug interactions with components of the combination analgesics. And to consider, are there other symptoms such as nausea that the person may be experiencing? In summary, despite affecting millions of people globally, effective pain management often remains elusive for many people. Paracetamol and non-steroidal anti-inflammatory drugs are commonly used as separate first-line treatment options for most people with acute, mild to moderate pain. Combination analgesics can produce a synergistic effect, enhance pain relief, and potentially reduce side effects compared to products that contain individual analgesics.